I'm going to start here then. Okay. I thought that this was something that if I hadn't have received and done, I wouldn't be where I am now with having these ideas and having the connections to be able to actually start doing some greater projects. Being new to the region, I really needed that initial push to kind of go, okay, what do we have here? What are some areas we can look at? And having the older adults take part in the study, I also got to talk to them as well, and so get their view as well, and then move on from there. So I think this has been a complete success from my point of view in terms of opening myself up to doing research in this particular area in this community.
I'm also relatively new to the El Paso binational metropolitan area. Sorry. I don't know what I did. Oh, and I'm grateful for this funding because I'm going to use these instruments, but I'd be fumbling through, and probably making changes on the fly when things weren't, when people said, what? Even when I was conducting the interview. Just that I've learned a lot just to be able to adapt this instrument and then just to see how important it is to have, your psychometrics aspect down and so on and so forth. So.
For me, as a scholar and scientist, it's no exaggeration here, it's been a turning point. Because my research is fundamentally theoretical, experimental, sessions are run within an hour in the confines and comforts of my laboratory. So I need to be extra motivated to go out and try to recruit people, make sure they come to all 4 sessions. For me, it's given me a pathway to see my scientific passion, which is bilingualism and reading and the cognitive aspects of it, come to life. I do feel my theoretical work has application, but it's very indirect. Now I get to see it in vivo. I identify very strongly with this region. I feel like I finally come home after 30 years of life. I finally found my real home. So it's also very meaningful for me to see my work directly translated in a way that can have a positive and measurable impact on this community that I care so deeply about. So if it wasn't for this initial opportunity, I might have missed it completely because I needed the initial funding to at least see if it was even feasible to take what I already know about bilingualism and literacy and turn it into something that is more directly applicable. As a matter of fact, one of my major goals of this summer is to now submit a proposal for grant funding from National Institutes of Health that would represent extension of this. And this pilot data I have will be essential in making my proposal competitive. It's too close. It's too close.
For me, this is the first time that I've done research that was directly related to health and health literacy. And I think that, well, I've been interested for a while in the question of how do we predict language proficiency based on self-report measures, but never really carried that through. And this was a nice opportunity to not only find out about that, but to relate it to health literacy in particular. And I'm planning to write a grant proposal that that incorporates this kind of research on a larger scale and in the community rather than just at the university. And it does take extra motivation, like Anna said, to do that when I can do my usual research just in the comfort of the laboratory. So.
I think Teresa had a question. Did you have a question, Teresa?
Well, actually, I have a question about one of the presentations.
Okay, then, that's fine.
Is that okay?
Yes.
On the asthma presentation, you were talking about African ethnicity, I guess. And it looked like the folks in this region are not too different from the Puerto Rican sample. Am I right there? Yes. So the Puerto Rican sample still had a much higher rate of asthma.
Africa.
Tell me again.
The European, Indian, and African, the differences are the higher percentage of the European and higher of the African and lowest of the Latin American. In the other study, they found that Native American is repetitive and African is detrimental for the development of the asthma.
I was just looking at the asthma rate differences. And because I'm in public health, I always think more about the environment than I do about the genes. So I'm wondering if the Puerto Rican population is somehow exposed differently, partly because they don't live here. I believe they're mostly going back east. And if their exposures make their rates of asthma higher than the folks here. Would you say that that's the case?
I don't understand.
Well, sorry. Estoy hablando de diferencia en asma. Los puertorriqueños tienen más que la gente de aquí. Y estoy pensando que tal vez es más porque tienen más elementos en su ambiente, porque viven en lugares diferentes, si viven en Nueva York o no sé dónde, que la gente de aquí, aunque parecen similar en su etnicidad, tiene diferentes, I can't remember the same rate. De asma. Entonces, ¿es más su ambiente?
No, it's an interaction in genetic environment. And in the other study, control the confounders about the environment, the lower level of the wealth.
Entonces, ¿tienen más asma?
Yes.
Aunque parecen similares de etnicidad. Sí, parecen similar. Los puertorriqueños y la gente de aquí parecen muy similar con su porción africana.
No, es muy diferente, es muy diferente.
¿Fueron lo mismo?
No. La proporción de los puertorricanos tiene muy alto porcentaje de europeo, alto de africano y bajo de latinoamericano. El africano es detrimental y el nativo americano es un factor protectivo.
Diane?
This is for anybody. Did you face any special challenges in recruiting your population, and if so, how did you overcome those challenges?
I had a focus group cancel on me twice last minute, and it happened to be a kind of a family group. So I kind of rethought the idea of having a family group, because then when something happened to one person in the family, and they were all, it happened to be, it was sad. It was the grandfather passed away or something, so they all went to the funeral, and then that was one thing. So and then I wasn't, because I'm really hands-on, and I like to do field research, and I like to talk to people myself, and I like to do my own interviews, and I like to just be there. I'm having to let go of it to get people to do the interviews and what is. So I couldn't look the people in the face and see exactly who the participants were. That kind of bothered me a little too. So, but maybe someday, shortly soon, we can all go back to what is.
For me, that was the biggest, and remains the biggest challenge. And but it's an important challenge for me to have, because my goal with this work is to make it to the point where it can have an impact on a significant number of people. And it's not feasible to teach thousands of people, give them 8 hours of instruction on a text structure strategy. So it's time for me to gear up, and the major goal of this summer is to figure out, how do I now package this differently, where it can be administered within a day, on site wherever the people are, and more accessible to people who aren't currently getting a university degree. That, for me, is meaningful. And so what I look for is feedback from those in the community who are involved in public health to give me some tips, pointers, hints on ways to get this effective strategy out there where it can be administered to community people. I'm thinking maybe I'm going to make a visit to Planned Parenthood, see if we can think of a way of delivering this, and then people who agree to participate get some sort of compensation, I don't know, free pap smear screening or something if you come and learn about pregnancy and reproductive health, for example. So it's a good challenge for me to have, because now I have to think creatively.
I can answer that, and then we can go to the other question too. I didn't so much have a problem getting the participants started in the study. So we had kind of this list of older adults that were in the community that were ready to go, and we had about 200 of them. And then as you phone call them, actually get them to come to fill out the paperwork and then show up for the first day, it kind of slowly goes into this trickle of, we get about 60. And so we started off with 62 actually in the study, and our goal was 60. And we retained them for the 12 weeks. However, we found sometimes they attended 75% of the sessions for the training, but then it was getting them at the testing that was sometimes difficult. And so we did a lot of makeup sessions, and you had to, schedule around cruises and, things that potentially they were doing vacation plans or family holidays or, and so getting those particular data was sometimes difficult. That's why in the end we had 49 full data sets, because in the end sometimes we just couldn't hold them back. We had a few people getting sick over the fall as we went into winter, and so illnesses also kind of cut out some of our data.
So where did that original list come from?
That original list, I had a co-investigator with me, Shandor Dorgo, and he runs the Golden Age Fitness program, so they are actually people that are waiting to join his program, and so we had that waiting list.
I have a general question to any one of you. How much do you think understanding health disparities, Hispanic health disparities in the border is different from understanding health disparities outside the border? How much the border environment is a factor or not? When one thinks about understanding Hispanic border health disparities or Hispanic disparities, what do you think? Do you think that that's important? The concept of bilingualism, for example, is fascinating to see in a border environment when there's a lot of both languages spoken. How much that affects? How much do you think the learning of the border intercedes the learning of disparities or doesn't?
I'll start. Previously, I worked with California farm workers, and it was a very stable population, and they've been in the country, well, they've either recently arrived or they've been there for 20 years and put downlands and so on and so forth. So Lisa's presentation was very interesting because that's where Vega did his work in the MAP study that she mentioned. And so the mental health indicators were real different in that stable population than they are here at the border. We found that the prevalence of depression is way higher here at the border than it is in a more stable farm working population in the interior of the United States, for example. So, and then I'm just talking off the top of my head, but the bilinguality, biculturality, different expectations, for example, of what a doctor should provide, and different expectations of, how much help the family should give. So I think the border is a really huge factor in the disparity issue, and needs to be taken into consideration in any consideration of health issues. I think the border is a big factor.
Question. As researchers, one of the advantages of being in this area is that we do have a border and doing research on the U.S. and Mexico side. And as one of the presenters said earlier, that having to collaborate with researchers on the Mexican side, were you able to find networks? How did that work? And is there an established network through UTEP whereby researchers can contact people at various universities and Juarez to work on research projects? Is is it loosely established, or who you know, or is there a list, a database that you go to and say, this is my topic, this is someone I can contact?
Well, I found a help through Pavo. I went to Pavo and I said, hey, look, I need someone to do some interviews for me, a contractor, outside contractor. And they provided the name of a couple of sociologists. So that was useful. And then I happen to have a bilingual, bicultural research assistant who lives here, but her boyfriend goes to Huasteota. So I was able to get some student research assistants through that. And then there's a number of professors that have collaborated with them. I have collaborated with DHHDRC, Luis Flores and so I feel like we probably all kind of know professors at Huasteota, and I'm sure that if you approach them, they'd be really happy to collaborate. I mean, I imagine, but I imagine it would be a fruitful collaboration. It would be good to establish something like a binational research network. That's a good idea.
I have a question that kind of feeds off of what you're saying. How is the travel limitations that are being placed on us as a university going to affect us from the outside populations of universities looking in at possible limitations because our researchers were not actually able to go into the area and had to find someone of equal ability to do their research for them?
One strategy that I think is not in this particular project that I talked about here, but in some of the research is I have a former PhD student who's a professor at Huasteota, and there are other psychology PhDs who got their PhDs at UTEP who are working at Huasteota. And so we know that they have the training and that kind of thing. And so I've collaborated, used those connections to collaborate. And I know some of my colleagues have as well. And that's worked out pretty well.
Question?
Yes, I have a question. The doctors that presented in the psychology department on health literacy, how likely is for you to continue on with your studies and using the sample population of the actual community, perhaps first generation migrant population or more, those that have been here for 5 to 10 years versus students? And the reason I ask this from a public health perspective is because working in the rural areas and working with the community, that's where we're lacking more of the information for us to determine what type of interventions to produce from the public health or the health department. So my question is to you, how likely is for you to proceed with your studies at the community level and not the student population level?
That's exactly what I want to do. So what I need is the connection with people in the community, because I don't even know where to start. I don't know who to talk to, and now I do. Because that was my major goal for the summer.
Invite you all to be a little bit more connected with the health department. You guys have a local health department, and we are here with the state health department at the regional level, and we're always looking for expertise and scientists like you to help us out. We need your expertise.
It's great, because I've been looking for you now, too.